tonight. One, we're in person. Two, we were hosted by St. Augustine's University, and we are thankful for our gracious host. We're here today in the chapel. It is a gorgeous space. Thank you for the community members and students and faculty and staff who are here with us today to talk about COVID-19. Where do we go next? We'll talk about long COVID. We'll answer any questions you have about booster vaccines and what's next. So a little background for you. Long COVID is a condition where people experience symptoms well after their infection has resolved. The symptoms can include fatigue and chest pain, shortness of breath, muscle aches, headaches, and brain fog. They may have trouble sleeping. They may have lost their sense of taste or smell. They can even have mood changes like anxiety or depression. We still don't know the exact cause of long COVID, and researchers are working to find better ways to understand and treat the condition. According to Wake County Public Health Division data, as of April of 2023, there have been over 100,000 cases of COVID in Wake County since the start of the pandemic, and up to 10 to 30% of those individuals may experience symptoms of long COVID. The symptoms can persist for weeks or even months after recovery. So you can imagine having these symptoms can really be debilitating, impacting how you do your work, how you do your daily activities, and even your overall quality of life. Unfortunately, amongst those most affected by long COVID are Black and Latino and Hispanic populations. They are more likely to experience severe COVID illness and thus more likely to experience long COVID symptoms. The Wake County Public Health Division is working closely with healthcare providers and researchers and community partners to address cases of long COVID. The division is committed to providing resources to those experiencing the symptoms regardless of race or ethnicity. Additionally, they are encouraging individuals who are experiencing long COVID symptoms to seek medical attention, participate in ongoing research to improve the understanding. By us all working together to address the disproportionate impact of long COVID on Black and Latinx communities, we can better manage the way COVID impacts our communities. So I will start by introducing our panelists. I am thankful to have my longtime partner in Ask the Doc Town Hall series, Dr. Stefanie Etienne, a physician and medical director with WellCare of North Carolina. And with me tonight is also Dr. Collin Ottey, an internal medicine physician with Advanced Community Health. Thank you both so much for being here. I will open it up first to you, Dr. Etienne. One, can you just please introduce yourself? And what's your thought on where do we go from here as it pertains to COVID?
I am Stefanie Etienne, and I'm a family physician. I've practiced in the Southeast Raleigh community for about 18 years. And I've worked really hard to help the community as far as getting vaccinated and trying to protect the members of the community against COVID-19. And as far as where do we go from here? First of all, I'm very thankful that after these 3 years, we have a brighter outlook. You know, the number of cases of COVID have dropped tremendously. However, COVID is still out there. And we really do need to take what we've learned from this pandemic and not forget how to protect ourselves. And we still have to be very vigilant and ensure that the members of our community and our families are vaccinated and be prepared for what may lie in the future. The things that we've learned will help protect us because you never know what may be on the horizon. And there are many things that we've learned that we can carry on, you know, throughout time so that we can ensure that our community stays safe.
Thank you, Dr. Etienne. We don't know what's in store, but we probably know this won't be the last time we ever see some type of significant respiratory virus in our community, whether it's a pandemic or not. So you're right, we really have learned a lot. We think about where we were 3 years ago And thank goodness the outlook is dramatically different. Dr. Ottey, please tell us a little bit about yourself, introduce yourself, and what are your thoughts on where do we go from here?
Yeah, I'm Dr. Collin Ottey. I'm an internist. I recently relocated here to North Carolina from Maryland. So I'm still finding my way around in the state of North Carolina, in the Raleigh area as well. But what I want to say is that COVID is still here. There are about 250 people that are still dying every day from COVID-19. So as Dr. Etienne just mentioned, that we still have to be vigilant about protecting ourselves and our family and just the community at large from COVID-19. So that if there's anything that I want to leave you here to you tonight, that's it, that COVID is still here and we still have to be vigilant about protecting each other.
Thank you. So we will begin the discussions and we will open it up for some questions for our panelists. If you are attending the event in person, you'll have an opportunity to ask questions during the event. If you are viewing online through YouTube or Facebook, please post any questions that you have into the chat for our panel to answer. So I'll start with a question about long COVID. So we just got some background information. We heard about what long COVID is and how many people it's impacting, 10 to 30% of those who have been diagnosed with COVID. Dr. Etienne, have you treated long COVID? Have you seen this in your patients? And can you tell us about what it looks like? We learned how it can impact people's lives. Can you tell us about what you've seen personally?
Sure. Unfortunately, I've seen quite a few people who are dealing with symptoms of long COVID. I practice as an urgent care physician in addition to being a primary care physician. And in the urgent care setting, as well as in my primary care practice, I've seen patients who were healthy as horses previously, no medical problems, no medications, who developed COVID. And, after a few weeks, most people get better. The fever's improved. They're not coughing, they're not short of breath. But unfortunately, there are people who have lingering symptoms. I've had many patients who just felt like they just couldn't get better. They felt like they were in a fog. They could no longer do their work duties because they couldn't concentrate. They were dealing with depression. Just, the pandemic alone was depressing enough, but to have that extra element of just not being able to feel like you can do anything. And they also had issues with chest pains, body aches, and just not able to, live a meaningful life. And it's pretty scary because you feel like there's no end. You just feel like you're not getting better. I know many of you may know people who have lost their sense of smell or taste. And there are some people most people do get those functions back after a few months, but there are some people who are still struggling with that and just to feel like you just don't see an end. And it's really important, for those who aren't vaccinated to know that this can affect you in that way if you contract COVID. So that's even more reason to get vaccinated because COVID, most people do feel better after a few weeks, but there's a significant number of people, as Dr. Monroe mentioned, up to 30% of people who have some residual effects that last for months and are still ongoing for years in some people. And we don't know why. There are things we can do to try to help with those symptoms, but it's something that if you can avoid it at all, if we can do whatever we can to avoid contracting COVID, that's half the battle.
Thank you for that, Dr. Etienne. Dr. Ottey, can you tell us about how you have experienced long COVID? So as a physician, have you treated patients with long COVID and what treatments are available? Because it sounds pretty scary, right? Long-term symptoms and you don't know when they'll end, of fatigue and chest pain and shortness of breath. So can you tell us a specific instance maybe of a patient and how, if you were able to treat them or help them symptomatically?
Yes, I've got I've had a number of patients who have developed long COVID. The one that comes to me is a patient with fibromyalgia. If any of you are familiar with patients with fibromyalgia, some of those patients tend to have a lot of pain. And after COVID, this patient became more sensitive to pain. She had more pain and more fatigue. In fact, she's still dealing with the symptoms of long COVID, and she had COVID over a year ago. So that just to tell you all the impact it can have. And one thing we need to remember as well is that the studies have shown that people who are not vaccinated tend to have worse outcomes with long COVID, or they're more predisposed or at increased risk for getting long COVID versus someone who was vaccinated. In addition to other medical problems that you may have, such as diabetes, obesity, lung problems, if you're a smoker, COPD, those type of issues as well. As far as the treatments are for long COVID, most of the time we basically treat patients based upon their symptoms, but we're finding out that there are certain medications that we have been using for years for different things, such as gabapentin, that may help more with the nerve pain that come from having long COVID. Also, sometimes people that have difficulty with their sense of smell and taste may benefit from gabapentin. A medication that we use to treat diabetes called metformin, I don't know if any of you are familiar with that medication, but that medication has been found to help people with long COVID. And some of the research that they've done, they show that people who were taking metformin and developed COVID tend to have less long COVID symptoms because of some new findings that they have had with metformin. And that's a common drug that, as I said, that we use to treat diabetes. Someone was saying if it pans out that we could use that, then and we have so much metformin, then we can cure everyone with long COVID, And, so, but it's a work in progress, and we just use medications as we go along to try to alleviate symptoms. Dr. Etienne, you might want to add to that.
For patients to specialists, because their symptoms are so severe, some people may end up with, they may have heart attacks, or they may develop severe lung disease where they have to see like specialists like cardiologists for the heart or pulmonologists. So much of the care is referred out to specialists if the symptoms are very severe. So that's even more burden on a person to have to go see multiple specialists. And we also have long COVID treatment centers. There are at least 2 in this area, one at UNC and one at Wake Med, where the doctors there have extensive experience working with patients who have long COVID, and they can really work with that patient to address the issues that they are having related to long COVID.
That's really helpful. So what I'm hearing is if a person is experiencing symptoms well after they had COVID infection, well after most things have resolved, that they should be in touch with their physician if they have one, that there are some treatments available, including some things that have been around for a long time that we've been using for diabetes and diabetic neuropathy that have been helpful with long COVID. And then there are treatment centers that specialize in the treatment of this. What about for people who don't have a physician or don't have insurance? What would you recommend, Dr. Ottey?
Since I work at Advance, I'm going to be biased. But Advance is a federally funded health center. So they offer sliding fee scale for people who do not have insurance. So if you're uninsured, that's a place that you'll be able to get care, just as if you have insurance. So that would be a place I would recommend people to go to. Yeah. Also, I know UNC has an access program that sometimes help patients who do not have insurance as well. And that also helps patients to see specialists as well, because we also participate in that with patients from Advance too. So there are some resources within the Raleigh area that you could access if you do not have insurance, but regardless of whether or not you have insurance, try to get yourself linked up with somewhere where you can see a healthcare provider to get some help. And then you can probably start accessing the services that are available from then.
Thank you. And thank you for reminding us about Advance. And it doesn't matter if you have the ability to pay or if you're insured, federally qualified health centers like Advance and other what we call safety net clinics in the area. I think of Alliance. I think of the Open Door Clinic at Urban Ministries. There's several different places where adults can get primary care and access to a physician if you're having those symptoms. So thank you for reminding us of that. Okay, so Dr. Etienne, you said we talked about long COVID and its treatments or things that can help, but you reminded us that vaccines will actually help reduce the risk of getting long COVID or for symptoms to be so severe. So let's talk about boosters. Let's remind the audience, where are we now? We've been in so many different phases of this pandemic as far as vaccines that it can be hard to keep up and know, like, am I straight? Do I have what I need? Do I need to get another shot? Like, what's what? So can you sum it up for us in an easy way? Where are we right now? Who needs what?
Okay. It's easy to sum up now. If you've never received a COVID vaccine, previously you would have to have a 2 vaccine series and at least 1 booster. Now you only need what we call the bivalent COVID booster. That's the most updated booster. That 1 shot. If you are a healthy person under the age of 65, that 1 shot would be all you need. Anyone who has who's over 65 or who has medical conditions that compromise the immune system, that they have the option to get an additional bivalent booster at least 4 months after the first booster. So if you've had that bivalent booster, that 1, and you're under the age 65, for right now, you're okay.
1 and done. That's where we are
Yes.
right now. 1 and done. If you are unvaccinated at this point, you don't have to get dose 1, dose 2, and a booster. You need 1 bivalent booster to be up to date. That's really helpful for children. If you're over 5 years old, that's the case. For children under 5 years old, there is still a 2 or 3 dose series, but it's all the bivalent booster. Can you remind us? So the bivalent booster means it covers the original strain of the circulating coronavirus and the Omicron BA 4.4, 4.5. So it covers the most up-to-date. It's the most up-to-date version of the vaccine that we have. So what about people who had like dose 1 and dose 2 back in 2021, but they never got anything else? What do they need to do? Still,
1
just
and done.
1 and done. 1 and done. Bivalent booster. Awesome. That's easy enough. I feel like the last time we were having this conversation, we were still thinking about if this, then that, if that, then this, but 1 and done. That's fantastic. What about people who, we've heard about the like the federal funding, like the emergency rules coming to an end on May 11th. What about costs for the vaccine? Because for all of the time that we've been delivering vaccine throughout the pandemic, it's been free to people. Where are we now? Can people still get free boosters?
People can still get free boosters, even if you're uninsured for right now. Even though the federal public health emergency is over, the vaccine is still out there. However, once the stockpile of the vaccine is depleted, there will be no more free vaccine. So that's an incentive for those who are unvaccinated or who are not up to date on their vaccine to go ahead and get the vaccine. So if you or anyone that you know are unvaccinated or need to catch up, now is the time to try to do that, because we're not sure how long the stockpile is going to last. So once that's gone, people will have to either file their insurance or pay for the vaccine at this point.
Excellent. All right. So one and done, it's still free for now. Perfect. All right. Dr. Ottey, this question is for you. Do people need to still wear a mask and social distance even after they've gotten their one and done, they've gotten their booster shot? Who needs to wear a mask and social distance? What are you recommending?
I think that's a difficult question.
For most people who are healthy
Right.
and don't live with anyone who's at high risk.
Then they can get by without wearing a mask. The CDC still is trying to decide in terms of what they're going to do in terms of their next recommendations regarding mask wearing. Some organizations are actually easing the mask restrictions. My recommendation would be in line with the CDC. If you're at risk of coming in contact with someone with COVID-19, you should wear your mask. If you have been infected with COVID-19 and you're going to be exposed to other people, you should wear your mask as well to protect others from getting COVID-19. And if you're in high-risk environments, you should protect yourself. For healthcare workers, I still would recommend it because we're not necessarily sure what our patients are. The people be working in high-risk environments. So for right now, I would say we should probably still wear a mask, but we should also practice hand washing, using alcohol-based hand sanitizers, those things, social distancing as much as we can. Remember, when you go to places that there's going to be a large number of people in closed settings, you should probably wear a mask. Those would be my recommendations for now.
Want to wear a mask? Those who want to wear a mask should wear a mask. Some people, it's almost the reverse now. Some people feel embarrassed or ashamed to wear a mask because people aren't wearing them. And people are shaming people for wearing masks. Do not be shamed into not wearing a mask if you feel like it's something that you need to do. It's a good practice. It'll keep you safe. So please, especially if you're at high risk, don't put yourself at risk by wanting to conform with what most people are doing. Most people aren't wearing masks, and that's okay. But if you need to wear a mask, you should be wearing a mask. And I'll also add that if you're traveling on like an airplane, a bus, or train, where there'll be a lot of people from who knows where, your risk of catching COVID increases tremendously. So you really want to make sure I would highly recommend that you wear a mask in those situations.
And also remember, in some countries, people have been wearing masks before there was COVID-19 because they were always protecting themselves from viruses and other illnesses here. So it's not unusual for people to be wearing masks in times where there's not a pandemic. And as Dr. Etienne said, don't be afraid to wear the mask if you feel like you're going to protect yourself.
Thanks for reminding us of this. I sometimes, if I'm, my children will say like, why are people wearing masks, or why are they wearing a mask? They'll kind of say to me like, they've been saying this for too long. Aren't we out of this pandemic? I have to keep reminding them it's still around. But I also remind myself that you never know who they are trying to protect, or maybe they're trying to protect you because they could be in their COVID period, right? They could have recently had COVID and they're actually in public days 6 through 10, and they're trying to protect you. So never try to shame or judge anyone when they're wearing their mask. You just never know the reasoning behind it. I want to make sure our audience has an opportunity to ask any questions. I have a couple of more questions from our audience members online, but our in-person audience, if you have some questions, I will give you an opportunity in just a minute to ask those. Dr. Ottey, I want to ask you one more question before I do that. what do you recommend for people as far as like getting their credible information? Where are you sending people? You know, there's still a lot of misinformation. You can get I mean, you open your smartphone and you're seconds away from misinformation sometimes. So where are you sending people to get accurate, up-to-date information about COVID, boosters, everything?
First of all, we hope that you all have providers who are not giving out misinformation as we see it during the height of the pandemic. But also the CDC is a reliable source for information on COVID-19, and that's where I send most of my patients, yeah, the CDC website.
Yeah, CDC is a trusted resource. I send people to wake.gov. So there's a couple of different places that you can get good information about what's going on in our community. So are there any questions from our audience members? If there are, there's a microphone here up to the left. Otherwise, I'm going to take another question from, oh, there is a question. Fantastic. If you don't mind, come up and state your name and ask your question. And even if you want to direct it to someone, you can do that too.
But anyone can answer. My name is Alicia Hill, and my question is there a vaccine especially for senior citizens, 65 and over?
There used to be a specific requirement for a certain number of vaccines for people who were 65 or older. But now that we have the bivalent booster, that is all you need. So if you had never been vaccinated, you would have that one, and then 4 months later, you can opt to get another one. It's not required, but studies have shown that it may be beneficial for people over 65 to have an additional bivalent booster, and that is optional.
So not a specific vaccine just for seniors, but a second dose of the bivalent booster is optional for seniors. Perfect. That's helpful. Any other audience members, you can step right on up to the microphone. Tell us your name and your question.
Hello, my name is Joe Vincent. I'm a senior biology major here at St. Augustine's University on a pre-med track. And I had a question, and it was, how was the diagnosis determined if the symptoms of long COVID can be similar to other chronic respiratory illnesses? And how, because I know for some people that like, you know, I like to diagnose myself and be like, I got this, and you know, they don't really go to the doctor. So how would a individual know on that term basis that they have long COVID?
So I think that's an excellent question. Thank you, Joe. I'm going to call you not by your full government because I met you earlier, our pre-med student, Joe. So how do you differentiate then between other respiratory things that can last and long COVID? Is that the question? How do you differentiate?
Well, some people who develop long COVID, they may not have some of those symptoms prior to having COVID-19. For example, the problems with chest pain, the neurological problems that they may have, they may not have had those problems before they develop COVID-19. And just based upon research evidence, you know, we can put that information together and determine that this person actually developed those symptoms after they developed COVID-19, usually after about the 4th week of having COVID-19, after their COVID-19 infection. Did I answer your question? Yeah.
Isn't it also true that some people may not have had a formal diagnosis of COVID-19? They could have had an asymptomatic case and still, or a low symptomatic case and still develop long COVID symptoms, which makes it a little bit more challenging. Have you seen that?
Yes, I've seen patients who have had mild symptoms or undiagnosed COVID-19 who developed long COVID symptoms as well. And there some people have written about this as well, that there are people who have never had a diagnosis, but they developed long COVID symptoms. So that's real, that happens, yeah.
We have another question from our audience, from our Southeast Raleigh Promise students. Fantastic.
My name is Azariah, and I'm with Southeast Raleigh Promise, and we also try to help people that suffer from lasting effects of COVID. And my question is, like, if people with serious health conditions, is it still safe for them to get the COVID vaccine?
It's a great question. Thank you for asking. People with serious health conditions, is it safe for them to get the vaccine? Should they get the vaccine?
That's a very good question. That is probably the group that really needs to get the vaccine. The vaccine was studied in all types of people, young, old, healthy, people who had compromised immune systems. And people with compromised immune systems are more likely to have severe consequences related to the COVID virus. So the vaccine it's imperative that they get vaccinated to help prevent that from happening. So we highly encourage those who are who have medical conditions or who are immunocompromised or have weakened immune systems to get vaccinated. The vaccine, like I said, has been shown to be very safe in those individuals and highly recommended for them.
Thank you. That's helpful. So not only should they, but that is exactly who it's for. We have a question from YouTube. Miss Brenda King asks, I have not received my booster because I was told I had COVID-19 and the booster is not needed. Dr. Ottey, I'm going to ask you this question. Is that correct? Was Miss Brenda King informed correctly? She doesn't need a booster because she had COVID and a booster is not needed.
She should still get the booster, even if she had COVID-19, because you can get COVID-19 again. There are people who have gotten infected multiple times. You can even think back to football. The quarterback for the Baltimore Ravens, I think he got it about 2 or 3 times. Yeah, so you can still protect yourself even after you've gotten an initial infection of COVID-19.
Thank you. We have another question from online. This is a tricky question. I'm not sure I know the answer to this because this is outside of my realm. It's like HR. Miss Arlisha Roberts wants to know, can companies terminate employees because of health-related conditions that require accommodations or remote work and are documented by physicians? I'm assuming that that means in relation to either returning to work because they've been remote, or it pertains to and not getting vaccinated. So maybe it's the question is about vaccine exemptions and if they can be terminated because they need accommodations. I'm not exactly sure, but what do you think? Do you have any insight on
I don't think they can terminate them due to their health condition. If they still have, significant symptoms and cannot work, I don't believe they can penalize them for that. There are some companies that require the vaccine to be employed with that company. So based on whatever company you work for, they can make that a requirement, as well as the flu vaccine. There's specifically many hospital systems have that requirement because you're working with patients and you're putting patients at risk if you're not vaccinated. So it depends on what type of company the person is working for. They may put stipulations on your employment based on whether you're vaccinated or not.
Also, to piggyback on what Dr. Etienne just said, long COVID has now been classified as a disability. So an employer can't discriminate against you because you have long COVID symptoms.
That's really helpful. And that's even more reason to make sure that you're seeing your physician and having this documented, because if it's classified as a disability and you are unable to do your job, then you'll need documentation to protect yourself and protect your income. So thank you. That's an important point. I have a great question from 10-year-old David Ellis on YouTube. David, thank you for submitting this question. He says, my grandmother was in the hospital for a very long time when she had COVID-19. I want her to get the booster, but she is afraid. how do I help her not be in the hospital again? How would you advise 10-year-old David who's worried about his grandmother, Dr. Ottey?
Try to encourage her as much as possible to get the vaccine because, again, like what Dr. Etienne just said, the vaccine is for someone like his grandmother.
And I think children are very influential. So, older people, if a grandchild comes to you, you're more likely to say, hey, I want to, be healthy and live for my grandchild or my child. So they tend to be more effective than others in convincing those who are skeptical about getting vaccinated to get vaccinated. And even letting her know, Grandma, you've been sick. We don't want you to get sick. We want to keep you around. We want you in our lives. That may be more appealing. And also to encourage her to speak with her physician or her healthcare provider, who should have a trusting role in their life to help influence her to get vaccinated.
And David, thank you so much for caring about your grandmother and loving her so much that you came to ask us that question. We appreciate that. Another question from Wake County Facebook from Armando Arias. Armando asks, I was vaccinated in another country and the dose is not available here in the United States. Is it safe for me to get what is offered here in America? Who wants to take that question?
Yeah, I'll take it. It's safe to get the vaccine here because we would just treat that person as if he wasn't vaccinated.
So one
The booster, yeah.
Booster and done.
Yeah.
One and done.
One and
There it is
done.
again. Fantastic. I see we have a question from the audience.
Isaiah McNeely from as well as with Southeast Raleigh Promise. My question is, since it was two statements that was made, one that is now being seen as COVID is now being seen as a disability, as well as it's also might affect the neurological parts. So since it's a disability, is it now seen as a neurological issue as well?
So long COVID
Long COVID.
is seen as a disability. Is it
But-
specifically a neurological
Yeah,
disability?
would it fall under neurological since
It's not restricted to neurology, to neurological disability. Could be psychological, could be respiratory, meaning lung disability that comes from it. The neurological disability is just one aspect of the multiple disabilities that can occur from having long COVID. Yeah.
Thank you. I have a question from online. Anonymous asks, are you seeing a trending down or uptick with COVID, RSV, and other respiratory viruses amongst school-age children 5 to 18 in Wake County? I will say, as a pediatrician, I am thankful that we are no longer in the triple, what do we call it, the triple demic of the massive surge of RSV and flu and COVID that we saw earlier in the winter. Right now, Wake County is in a low transmission rate for COVID. And so this feels, I'll say personally, this feels like previous years before, prior to the pandemic, that we're having, some colds and fevers and things oftentimes, but it certainly is not the surge that we saw in the winter. So definitely a downtrend since then. Thanks for that question. And we have a question in person. Thank you.
Hi, my name is Kimberly, and I also work with Southeast Raleigh Promise. So a question that I had is, why is it that African Americans and Latinos have a high percentage in long COVID cases?
That's an excellent question. I want to start I'll start to answer that question, then I'll open up to our panelists. So I do like to point out that it's not the biology of Blackness or brownness that makes us more likely to have COVID disease and worse outcomes. it really does come down to the structural, like historical and structural racism. I mean, if you think about the things that make people more likely to have significant disease, right? It's comorbidities. So high blood pressure and heart disease and diabetes. And you think about, the historical factors that shape communities like Southeast Raleigh is one of those communities that are less likely to have, fresh fresh food available and access to primary care physicians and green spaces to walk around and housing that isn't, compact and multi-generational. And then you think because of access to, education and high-paying jobs, and who was more likely to be on the front lines, or who was more likely to still have to see people face to face working through the pandemic and not be able to sit, at home behind their computer desk. You think about what it took to get access to vaccines and see your primary care physician, and you needed a computer and internet access and transportation. So you think about urban and rural communities that have been historically marginalized. And again, that is like to point out by intention and by design, not by accident, that shaped these communities, that put them in the place where when this pandemic happened, it really was an absolute imperfect storm that made these communities much more vulnerable to not just contracting COVID, but then getting very sick and dying from COVID. So I just like to point that out. As a medical student, Dr. Etienne, Dr. Ottey, I don't know if you feel the same way. I was in medical school more than 20 years ago. I just remember how many times I heard, and Black patients are more likely to have this, and Black patients are more likely to have that, and Black, and Latinx have higher rates of this and that. And I thought, well, good gosh, what don't we have higher rates of or worse outcomes for? But the sentence was never, or the statement was never followed up with, and that is because, right? And so it implies that there's something innate and sick about Black and brown bodies, and that is not the case. So I like to point that out whenever I can. Anything else, Dr. Etienne or Dr. Ottey?
I don't think I can say it any better. Everything you said was spot on. And I'll also add that there is a significant element of mistrust. And I think that influenced a lot of Black and brown people initially to not get vaccinated. If you look historically, Blacks in particular, African Americans in particular, have been experimented on. Think of the Tuskegee experiment with syphilis, and we can go on and on. So that those things stick, and people, if you don't trust something, you're not going to want to do it. So thankfully, we have had people in the community like Dr. Monroe, myself, and other people of color who worked tirelessly to help get our communities vaccinated. So, it's not, I'll stress again, it's not Blackness or brownness that make it more likely for you to, have a higher risk of developing long COVID or really any other medical condition. It's just the, systemic racism and barriers that are in place to impede your health.
Did you have something that you wanted to add, Dr. Ottey? You look like you're primed to say something.
No, I was just thinking that it even goes beyond COVID-19. When we talk about the care that patients of color receive for things like heart disease, those things, you see the disparity as well. So it's something that we always have to be aware of. And that's why we do these forums, so that we can educate you and you can go back and educate someone else in the community.
Thank you. That was an excellent question. I appreciate you asking it. Even though that was an excellent question, I have my favorite question so far that just came in from 6-year-old Romano RAS in Wake County. Romano asked the best question because he wants to know at 6 years old, is the needle that's used for the vaccine, is it made for little kids, or is it a big needle made for big kids, big people? And I will say that it's a teeny needle. It's a little needle made for little people. And the vaccine is so fast and painless. I can't tell you, I vaccinated thousands of people with our vaccine events that Dr. Etienne and I worked together. I can't tell you the number of people that would look at me and go, "That's it? Are you done?" So it's a teeny needle, and most people do really, really well with getting the shot. So thank you, Romano, for asking that question. I have a question from Bernadette Scott, who asks, are there any recommended standards of care for COVID and pregnancy? So COVID and pregnancy, Dr. Etienne, do you want to help answer that question from Ms. Bernadette Scott?
Yes, I can. Women who are pregnant can receive the exact same treatments that anyone who has COVID can receive for the most part. And one of the main treatments for people who are at high risk for complications from COVID infection is a medication called Paxlovid. And that is still available and is highly recommended. Pregnant women are considered to be high risk, and they're considered to be in the immunocompromised group. Unfortunately, that was one of the groups that we saw a lot of death and morbidity or severe health problems related to COVID in. So we really stress that these women, actually get vaccinated, of course, to prevent COVID infection. And we still stress that. So if you know anyone who is pregnant, who wants to be pregnant, or if you're pregnant, get vaccinated. It is safe and highly recommended in pregnancy. The American College of Gynecology strongly recommends and support vaccination in pregnancy because it is safe, and it is highly recommended that women who are pregnant who develop COVID receive treatments such as Paxlovid to decrease the severity of symptoms and the impact on the mother and the baby's health during pregnancy.
Thank you for answering that. As a pediatrician, I'll also remind people that it also gives the baby some protection. And the earliest that a child can get vaccinated with the bivalent booster is 6 months. There's no vaccine available for infants under 6 months. And so a pregnant person getting the vaccine and giving those antibodies to their baby, and then if they breastfeed, continuing to give antibodies to their baby is one of the best things that they can do. So fantastic. Thank you for that. I think we are almost at our last question. This might be our last question unless, okay, we'll take one from the audience and then I have one last question from YouTube. So I'll let you go first.
Okay, my name is Ananaya. I'm with Southeast Raleigh Promise. And my question is, since summertime is here or is coming up, with all the parties and hangouts that are happening, do we still need to keep the COVID protocols in place?
That's a great question. She's like, it's time to be out. Like, what can we do? So one thing I'll say is because it's warm and the weather is nice, ventilation is always your friend. Ventilation is your friend. And so Dr. Ottey, I'll let you start with this because you were talking about how if you're in, tight spaces, or if you're high risk, if you're going home to someone who's high risk, then you might be more cautious. What would you recommend for our student about wanting to be out?
I would say since you're going to be out, if you can social distance, that would be great. But I would also say use your mask as well, because if you're going in settings where there are going to be a lot of people, a concert, or some other activity in an open space, you may still want a mask up.
Outdoor concerts are lovely. That will help keep you safe. And you just have to think about the risks, right? If you're a healthy person and you've been boosted and you live by yourself or with healthy people, you might go to an indoor concert and say, I'm willing to take this risk, knowing that I hopefully will be well and I'm not bringing this home to my grandmother who is immunocompromised. But other people might make a different calculation, and they might say, I'm going home to an infant who whose parent wasn't vaccinated, or mother wasn't vaccinated, or I'm going home to my partner who has cancer and is on immunosuppressants, and I'm going to be extra cautious. I'm going to be out. I'm going to go to this concert, but I'm going to wear my N95 and I'm boosted, and I'm going to do that extra protection. So I think everybody will have to decide what's the right thing for them at this point. I have one last question from Kirsten Ingram on YouTube. What can we do to strengthen our immune system so that our body can fight off the development of infections? Generally, what can we do to make sure our immune system is at its best fighting shape? Dr. Etienne, I'll start with you.
The first thing is to make sure you're eating a healthy, balanced diet. And that would include fresh, unprocessed foods, lean meats, fruits and vegetables. We say eat the rainbow, eat colorful, fresh vegetables, drink lots of water, exercise, get regular exercise. You don't have to belong to a gym, but stay active, keep moving, stay active, and take care of yourself. You know, do things to help relieve stress, take multivitamins, vitamin C, vitamin D is good, zinc, things to help boost your immune system. But in many cases, if you eat a balanced diet and try to stay away from a lot of, fast foods, greasy foods, unhealthy foods, and just take care of yourself, that will be very helpful in, boosting your immune system.
I'd like to add two things. So one, I don't believe in exercise, but I do believe in joyful movement, because exercise sounds hard to me. But I do like to move my body in a way that's fun. And so that's like a walk in nature, listening to my book on tape, or listening to music, or it's dancing. I love to dance. And so joyful movement, I can do that. I can get on board with that at least 4 times a week. But if you say exercise, I'm like, oh, I'm tired. And the other thing that I'll put in a big plug for, I'm super, super passionate about as a pediatrician, is talking about is get enough sleep. Please get enough sleep. None of us are getting enough sleep, and kids are not getting enough sleep. And you don't understand, sleep is your rest and repair time. Okay. So it is repairing the damage that happened during the day. I remind my 2 boys who want to keep growing, it's when you grow in height. So for kids, it's when you're getting taller at night. But it's a time that your body is healing itself. And so we are chronically not getting enough sleep. It impacts not just our physical health and our immune system, and increases our rates of diabetes and heart disease and all these different things. It really impacts our mood. So when we think about the mental health crisis that we are in, that was worsened during this pandemic, and we think about, especially in the teens, I'm seeing so much anxiety and depression. The first question I ask, maybe not the first, one of the first few questions I ask is, tell me about your sleep. What time is bedtime? What are you doing before bedtime? Are you consistently going to bed at a reasonable time and getting enough sleep? So I'll remind you that for kids, this is just generally for kids. Kids in like elementary school still need to be offered 12 hours of sleep. Exactly. And I see someone in the audience going, what? And that's why I remind people of that, because their parents think they're supposed to be getting 8 hours of sleep because that's what we've all been told. That's what I'm supposed to get, but not an 8-year-old growing body. They're still supposed to be offered 12 hours of sleep. A middle school kid, about 10 hours of sleep, and a high school kid who's closer to an adult, about 8, but still sometimes closer to 10. So that's kind of my rule, 12, 10, 8, kind of marches down by 2 from elementary school to middle school to high school. Toddlers, so before elementary school, they're still 12 hours at night plus at least 2 hours of naps. Okay, so for you as an adult, most of the people here are adults, you really still need to be getting about 8 hours of sleep. A lot of us are getting 6 on a regular, 5 on a bad day, 7 when we're lucky. And when you do that chronically, I want you to think of that as the sleep deficit. Think of how many hours in a week that your body was supposed to get of resting and repairing that it didn't get. All right, I want to step off my my soapbox now, but it would really resolve so many of our mental and physical health concerns if we started by getting enough sleep and moving in a joyful way most days of the week. Dr. Ottey, do you have anything to add? Do you have a soapbox that you need to step on?
No. You address my concerns about sleep and taking care of your mental health as well.
Thank you. All right. Well, I think we are coming to an end tonight. I just, again, want to thank everyone. There's lots of beautiful people here in the room. Thank you for your questions, your participation. Thank you to St. Augustine's College for having us here and hosting us here in this beautiful chapel. Let's see. I want to ask you maybe like your last take home point, Dr. Etienne. I think mine is one and done when it comes to vaccines and boosters. If you're over 5, it's bivalent, one and done. What do you think? Do you have any takeaway points that you want to make sure our audience leaves with?
If you are unvaccinated or not up to date with your the most updated booster, the bivalent booster, please get vaccinated. The vaccine is safe and it's available for 6 months and up. And if you know anyone who is not vaccinated, please reach out to them and encourage them to get vaccinated. It may take 6 times before they do it, but if they mean something to you, take the time to speak with them and try to meet them where they are to encourage them to get vaccinated. COVID is still out there, and as we discussed, long COVID is still an issue. And if you can get vaccinated, you're less likely to develop long COVID and consequences of that. So please, the vaccine is still important, and we all need to be up to date.
Thank you, Dr. Etienne, and thank you so much for your participation, not just tonight, but in the past years of Ask the Doc Town Hall. Thank you so much. Dr. Ottey, what is your last word that you want to leave our audience with?
Remember that COVID-19 is still here. People are still getting sick and people are still dying from COVID-19. Again, get vaccinated. Also take care of yourself in some of the ways that we suggested. And take care of everyone around you too.
Fantastic. I think if there's one thing that we really learned from this pandemic was how important what actions we take really impacts our entire family, community, environment, right? Like we don't live in isolation of one another. And so my last word will be take care of yourself, take care of others, take care of your community, and be well. Have a good night, everyone.